The opioid epidemic earned a dubious distinction as the #1 cause of accidental death. An estimated 2.6 million Americans are currently addicted to prescription opioids and heroin. The Center for Disease Control and Prevention also reports a spike in opioid overdose deaths from 8,200 in 1999 to, look at this, 33,000 in 2015. Joining us now is Dr. Sally Satel, a resident scholar with the American Enterprise Institute. You also wrote an article in the Wall Street Journal, and you treat methadone users.
Right.
Tell us, what role have drug companies played in this epidemic? Have doctors played in this?
Yeah, well, there's enough blame, if you will, to go around. But I do think almost everyone was well-meaning here. Doctors, starting in about the mid-90s or so, they wanted to compensate for what was clearly a widespread under-treatment of pain. It was pretty much limited to cancer patients and terminal patients, but the pendulum swung too far in the other direction. They were a little too liberal with their prescribing. Some drug companies did understate the addictive potential of their drugs, and that was not a good combination.
And hence we wind up with these startling statistics. You work with addicts, and they don't want to give up their drugs, so how do you treat them?
Well, the people in my clinic, thankfully, largely do want to give up.
Because they listen to Sally.
No, they came into, by definition, they came into a treatment program. Now, they came into a program called a methadone program, and methadone itself is an opioid. It's been around since the 60s, and it's a replacement drug, so to speak. It's obviously pharmaceutically pure. People get it once a day, as opposed to heroin, where you don't know what you're getting. Your needles might be dirty. It might be contaminated with fentanyl, which is incredibly powerful, and you have to take it several times a day and spend a lot of your time hustling for it. So methadone once a day, it's a clean drug. A lot of the folks come in at 6:30 in the morning, swallow it, and they're off to their job. So I'm very much in favor of that for people who feel they need it.
Sure. It sounds like you're over your treatment versus punishment, right?
Well, in general, yes. And that, thankfully, is kind of a new attitude that's pretty widespread now among politicians, a lot of enforcement people, what's called a public health approach with an emphasis on treatment, even an emphasis on something called harm reduction, with the recommendations of programs we never would have considered before, like safe injection rooms.
Oh, right. You think that's okay, though?
I have to think it's okay.
Why?
Because fentanyl is a synthetic opioid. It is 1,000 to 5,000 times more potent than heroin. You can die with it in your arm before you finish injecting.
And that's a safe treatment, is what you're calling a safe treatment, the fentanyl.
Oh, no. The fentanyl is the deadly synthetic opioid.
You can tell I'm not.
I know, it's so powerful. I'm saying it's it could be 5 or 10, about 5,000 times more potent than heroin. So this is why we need, I believe, in some cities, they think they need, and I respect local control here, they think they need a place for these folks to go to inject. They bring their own drugs. I know it sounds very controversial, although it's done in Europe and in British Columbia, and there's a nurse there to revive them, and we do have a good antidote.
Very quickly, faith-based organizations, what can they do to help?
They can take people in. They can, I'm for anything that works.
Okay.
And,
well, I think everybody is.
Right. And if someone who finds comfort in that kind of approach, then they should use it, and we should promote it.
Dr. Sally Satel, resident scholar with the American Enterprise Institute, thank you so much for joining us.